Good afternoon, everyone, and welcome to the SAMHSA's Gain Center webinar on Family Matters, Transitioning Towards a Family-Centered Approach in Drug Courts. Thank you so much for joining us today. I am Melissa Neal. I'm a Senior Research Associate with Policy Research Associates and also the lead for communications with the Gain Center. Just a couple of housekeeping items. First, we'd like to make clear the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have questions, we have a Q&A portal that will be on the right side of your screen. And we welcome you to submit questions as they arise throughout the presentations. And once we reach the end of the presentations, I will help facilitate the Q&A at the end of our presentations. We have two polls open right now. We'd love to hear from you. We'd like to see where people are joining us from, whether it's a rural, suburban, or urban location, as well as what kind of organizations you're joining us from. So if you would please participate in those, we would appreciate that. And lastly, this webinar is being recorded. And we've got a full agenda for you today. We've got three presenters who will be sharing more about family courts and why a focus on family in the treatment court, specifically drug treatment court settings, is important. But first, we'd like to turn it over to John Berg for some opening remarks.
Transitioning towards a family-centered approach in drug courts. We appreciate you taking the time to participate in today's informative webinar. SAMHSA funds many types of adult treatment drug courts, including DUI, DWI, veterans, family, tribal healing to wellness, and municipal courts. Traditionally, drug courts have aimed to reduce drug relapse and criminal recidivism by offering risk and needs assessments, judicial interaction, monitoring, and supervision, graduated sanctions and incentives, substance use disorder treatment, and other recovery support services. Through many studies, adult drug courts have been shown to produce better outcomes for participants with substance use disorders who are considered high risk and in greater need of intensive supervision, our behaviorally accountability, and evidence-based treatment services. Typically, drug courts have focused service delivery primarily on the individual involved with the criminal justice system. A 2014 SAMHSA brief reported that family drug courts across the nation demonstrated that child, parent, and family well-being outcomes improved when a comprehensive, family-centered approach was used to address specific needs of children and families, in addition to the parent's recovery. We are invested in helping drug courts improve their effectiveness and believe that implementing a family-centered approach is certainly one component to achieving that goal. We are excited to host today's webinar to present on how to transition adult drug courts towards a family-centered approach. We are pleased to have three very distinguished presenters today, Tessa Richter, Tara Reno, and Judge Montero. I will turn it back to Dr. Neal at this time.
Thank you, John. All right, and we have closed our poll. And looks like many of you are joining us from rural settings. And then as far as organizations go, we have quite a few joining us from the judiciary, academia, research, and a few other, and from government. So thank you so much for joining us today. Now I'm going to introduce our panelists for today's presentations. First, we have Tessa Richter, and she's a program associate for the National Family Drug Court Training and Technical Assistance Program for the Center for Children and Family Futures. She also serves as the program manager for the statewide System Improvement Program, where she oversees efforts to improve outcomes for families impacted by substance use disorders within the child welfare system. Prior to this position, she was the problem-solving court coordinator and juvenile programs coordinator for the 1st Judicial District in Colorado, where she coordinated the Family Treatment Court program in Jefferson County, Colorado. She's a licensed clinical social worker and has had experience as child welfare caseworker as well. Next, we have Tara Reno, and she is the 1st Judicial District Court Coordinator for the Recovery Court in Golden, Colorado, and she oversees the daily operations of this program. She's had almost 6 years of experience in problem-solving courts and has served as a probation officer in this setting for the 1st Judicial District Juvenile Mental Health Court, and then served as court coordinator in the Adult Drug Court. She has a Master's of Art in Clinical Mental Health Counseling. Judge Michael Montero is the district judge in the 6th Judicial District Court in the state of Nevada. He also chairs the North Central Regional Judicial Council and serves as a representative on the Judicial Council of the state of Nevada. Judge Montero is a Nevada delegate to the National Conference of State Trial Judges of the American Bar Association, serves on the Nevada Supreme Court's Committee to Study Evidence-Based Pretrial Release, the Specialty Court Funding Committee for the Judicial Council of the state of Nevada, and is a past president of the Nevada District Judge Association. He's currently the only district court judge in Humboldt County, Nevada, and is presiding over several treatment courts, including the Adult Drug Court, the DWI Court, Mental Health Court, Truancy Court, and the Family Treatment Court. So without further ado, I'm going to turn this over to Tessa Richter to kick us off.
Thank you so much, Melissa. Hello all, and thank you so much for joining us. Tara, Judge Montero, and I are so excited to share with you some concepts, strategies, and next steps to help you and your team move towards a family-centered approach, whether it's in your adult drug court or veterans court or DUI court or any court serving adults and also families. As Melissa said, I work with Children and Family Futures, and our mission is to improve outcomes for children and families in the child welfare system affected by substance use, mental health disorders, and trauma. We serve as the National Training and Technical Assistance Provider for the National Family Drug Court Program, and in that role we have been working with states and counties across the country to help them improve, enhance, and expand their family treatment courts to improve outcomes for children and families. In the last couple of years, we've also started working with some adult drug courts who have been wanting to enhance their services to serve the entire family. And so today I'll be talking with you a little bit about what we've learned from both family treatment courts and those adult drug courts, and talk with you about why this is important, how it can help you and your participants, and a few next steps. And then I'll turn over to Tara and Judge Montero to talk about how they've put this into action in their counties. So we will start with, why is this important? So number one, we know there's a big need to serve children and families affected by substance use. In SAMHSA's latest survey on drug use and health, we found that 8.7 million children live with one or more parents who are dependent on alcohol or need treatment for illicit drug use. Now, we know all of those families do not come to the attention of family drug courts, and we know they do not all come to the attention of child welfare even. But some of those kiddos and families are coming to the door of the adult drug courts. We like to say that there's no wrong door to help children and families affected by substance use disorders, and so we encourage you to think about how adult drug courts or adult courts can be one method to help improve outcomes and to get services into the hands of families and children who need them to help keep them safe and healthy. Through our work with some of the adult drug courts, we worked with 3 who have really been trying to put some of these practices in action. And through doing that, some of them did some surveys and asked some questions about their participants. And of those 3 adult drug courts, they found that 50 to 70% of their participants had at least one minor child, whether that was in their care or not in their care. So we know that there's a lot of kids who could be coming to the attention of the adult drug court world, and so this is an important topic to explore. We also know that family issues can really affect recovery. Montana was one of the states or sites that was doing some of this pilot work, and they started asking more questions of participants as they came into the program to find out what their family strengths and needs were, along with the individual strengths and needs. And so as you can see here, of the participants who were parents in the program, over 50% of them had concerns regarding their children's social and emotional well-being, their medical problems or health, or their children's behavior. So as you can imagine, if a parent feels that they may have had a negative impact on any of those things, it's going to be important to address them. Another important piece to note here is that if the parent feels that this is an impact, this can be a really big motivation for them. So if we can make sure that we're talking with them and tapping into their role as a parent and providing services to the entire family, then it is more like, we can really tap into that motivation. We really encourage everyone, this is family treatment courts, child welfare, adult drug courts, to rethink recovery and to think a little bit bigger. We know in the drug court world across the board, we can get stuck a little bit into our phases and phase requirements, drug screening results, treatment compliance, graduation, but we also know that recovery is bigger than that. SAMHSA's definition ties into health, home, purpose, and community. And so if you think about those things, it shows that individuals don't live in isolation, and so we can't treat them in isolation. And to think that for people who, whether they have children or obviously they're just part of a family unit, they come to a drug court, we need to make sure that we're asking them about those relationships. And we're seeing where services could be applied to help strengthen those and to help them get into an environment of recovery. We know that substance use disorders impact all relationships in the family unit. So even when you're only seeing the parent, the reason they are there, the substance use disorder, it's impacting the entire family unit. If we are only focusing on the parent's recovery, we're missing out on a few things. First of all, we know that adults with children typically identify themselves primarily as parents. If you were to ask me anything about myself, I would definitely tell you about my 2-year-old son before I would identify myself as a social worker or a wife or a daughter or a sister. So if we're only focusing on the parent and not addressing that role, like I said, we're missing a few things. There can be a lot of guilt and shame just in parenting in general, but there's also a ton of guilt and shame involved in substance use disorders and in relapse and in going through that early recovery process. And if you talk to your treatment providers on your team, or if any of those treatment providers are on the phone, that's a big topic that gets talked about, and how to deal with that shame and guilt through treatment. So if we're not addressing or talking with the parent about how their substance use has affected their children, how they're dealing with that, how to help that relationship heal again, then we're missing the whole boat on that shame and guilt as a parent, which can just lead to an increased risk of relapse, which could lead to either the removal of the children or the re-removal of the children and additional trauma. Also, if we're not addressing that, we're also threatening the parent's ability to establish a healthy relationship with their child, and so help that attachment, which will just continue to help perpetuate that cycle of abuse and neglect, or can help perpetuate that. We also know that kids, if we're not addressing their needs, these are kids who aren't ready for school. They might be in special education caseloads, in juvenile justice caseloads. Kids in the child welfare system affected by substance use disorders are more likely to be in foster care and less likely to return home. They're more likely to be in residential treatment and develop their own substance use disorders. And this is something you guys all know. These kids who we don't serve through whatever door they come in, whether it's adult drug courts, family drug courts, truancy courts, these are the kids that become our clients, our adult drug court clients in 5, 10, or 20 years, or our family treatment court clients. So there's a real incentive to be treating the entire family unit and try to end the cycle of abuse and neglect in families and create healthy families. We've been learning more about services, including evidence-based services that can treat the entire family unit. So look at this graphic a little bit and think about how family-centered are your services and approach at the time being. Down at the bottom is the parent your primary focus of recovery. This is often where a lot of adult drug courts are, and even where many family drug courts started, and where we're trying to move out of just focusing on that parent in isolation. That next step up is the parent the focus, but maybe the team recognizes that the children are involved. They're asking questions about the kids. The treatment providers are working with the parent on the parenting role in recovery. Maybe treatment providers or the court is providing child care in some form or fashion to recognize that the parent has some conflicting responsibilities. The third step up is looking at the parent and the child each receiving services and having case plans. So maybe the child's receiving individual therapy on their own while the parent is in substance use treatment. They're receiving developmental services perhaps. And then the last step up, called family-centered, is where the services are focused not just on everyone getting the services they need, but also on the parent-child dyad. So that can be some of the parent-child relationship services, and we'll get into some of those examples soon. So some of our research is showing that when you're addressing the parent-child relationship and you're serving the parent and the child together and recognizing the role of the parent and the family, that treatment outcomes improve. There's improved positive outcomes for children and women. There's improvements in treatment retention and higher treatment completion rates and longer stays in treatment. And we know all of those things lead to better outcomes. So in the child welfare world, we know that if a parent enters treatment sooner, they're more likely to stay, they're more likely to complete, and that means they're more likely to reunify with their children. We also know that if you can move to this family-centered approach and serve more families, research has shown both a reduction in criminal recidivism and an increase in cost savings. And this research is just for adult drug courts that provided a parenting class. So doing something that is potentially as simple as adding a parenting class and recognizing the role of the parent can reduce recidivism and increase cost savings. So that was a little bit about the why. I'm going to move into what we call the 3 N's, numbers, needs, and networks, to start thinking about what you could put into place to move into a more family-centered approach. So we definitely don't expect anyone to go from one end of the continuum to the other overnight, but there's a few strategies you can consider. Some of them as simple as asking a couple questions, others more complex or might take a little bit more time as far as forming some community partnerships. And then we also have some of these strategies listed in a handout called the 3 N's, and I'll show you a resource on that at the end. So our first N is numbers. Our key strategy is to just start identifying parents with children. Start asking the questions. Like I mentioned earlier, Montana started a screener to ask about who was involved in the family, what are their strengths and needs. You can ask if child welfare is involved or if it has been involved previously. And if they're involved, there's a whole gamut of extra resources that you could connect to and help bring into your court. Start asking, so a big piece of this is also about data tracking. We know that you can't change what you can't count. If you can start counting certain things about families and recognizing what percentage of maybe caseload, let's say, has kids in the 0 to 3 age or in the school age range, what percentage does have an open child welfare case or have the kids at home or an out-of-home. All of these things will help make your case with agencies. They will also help you figure out what services are needed and how to better serve those families. When looking at numbers, we also encourage you to start thinking a little bit bigger as far as performance measures. So outside of drug court or probation or recidivism kind of numbers, the bottom ones here are about parent education and child intervention. So if you're adding some of those services, just start keeping track of, are they connecting to those services and did they complete those services? Also on here is what child welfare performance measures look like, and just to give you an idea of what child welfare is looking at for child and family outcomes, as well as substance use disorder. Our second N is needs. So providing services that support family needs and the parent-child relationship. So this does build on to that number. So once you're asking and finding out who is in your court and who needs to be served, then you can start developing services. Here's a few of the key service components, and I'm just going to highlight about 4 of these. So that top box, as far as developmental and behavioral screenings and assessments, this is a really great one. This is often might be called early intervention in your community, but it's a community-based program that provides developmental assessments and early intervention services that are typically high quality and free to families. The biggest thing is just getting families connected with them. if you can make a connection with them in your community, just say, hey, we're the adult drug court in the community and we have X number of kids that come through and we would love to be a referral source or help support families in completing their evaluations and getting into services. That could be a pretty simple connection that would get your kids speech therapy, physical therapy, other developmental assessments and services. So that's a great one to start with. The second one here is about quality and frequent visitation, which we've been trying to change our language to be more about parenting time versus visitation. So research has shown time and time again that regular, frequent parenting time, if a child has regular, frequent time with their parents, they're more likely to reunify, and they're more likely to reunify sooner, and they're less likely to come back into care. And visits are really a child's right. So what we would encourage adult drug courts to do, because oftentimes you may not have the ability to control parenting time, but you can help support it and you can help remove barriers to it. So find out if they have an open child welfare case and what their parenting time schedule looks like, and make sure their drug court treatment isn't running into those requirements around parenting time. Even if they don't have an open child welfare case, they may have scheduled parenting time or supervised parenting time, so you can find out and ask about that. Our third service here is about parent-child relationship-based interventions, and this is something that's really come a long way. There's a lot of evidence-based services here. Some of them are Medicaid eligible, and a lot of these can just be game changers as far as healing that relationship between the parent and the child and working on increasing that motivation for a parent to move into recovery to help their child. So some of those to look for in your community are child-parent psychotherapy, trauma-focused CBT, and parent-child interactional therapy. So those are some great ones to look into. And the last one I want to highlight here is about parent education. So this is another one that might exist in your community already. A lot of these are evidence-based programs specifically created to work with families affected by substance use disorders or families affected by substance use disorders in the child welfare system. So looking for celebrating families, strengthening families, and nurturing parenting, and a lot of the home visitation programs, nurse-family partnership, and those sorts. So talk to your health department. If you have a family treatment court in your jurisdiction, talk to them, see who they're already connected with, talk to your child welfare agency in your county, and see what's available. Another strategy here is to think about how you're responding to behaviors and if those can be more sensitive to the needs of the family. So talking about incentives and sanctions. And we just ask that something as simple as when you're deciding on a response, think about what the impact of that will have on the child and the parent-child relationship and their participation in maybe a child welfare case plan or in a family case plan. So if you're thinking about using jail as a sanction, stop just a minute and think, if that parent goes to jail today, what's happening to that child? Is there someone to pick them up from school? Do they happen to be in the courtroom? Then they're going to be watching that. Is there someone safe to watch them? Is it getting in the way of parenting time? So those are just some of the pieces we would ask you to consider. Our last N is about networks, and I've kind of alluded to this a little bit, but this is where we would encourage you to think just what already exists in your community. Who might be on your team or on your steering committee, or who might be missing on your team or steering committee, steering committee, who knows about resources in the community and could make those connections to help with the referral string. This is why it's really good to know your numbers so you can make a case. If you can go to an agency and say, hey, we have 45 children a year who are between the ages of 0 and 3 who really need these services, and we can provide the oversight to help them get those services, that can be a really great case. So here we would just encourage you to refer and follow up, and then also just recognize that these can be slow partnerships to start. So maybe it is just that call that you make and talk about your program and your outcomes and why you want to refer, and then those partnerships can build up over time. So some examples are here on this slide. One adult drug court partnered with their treatment center to provide comprehensive family and children services. Another advocated an assets treatment provider to go ahead and provide family therapy just within the agency that already existed. And then another one worked with their treatment provider to track some of those family outcomes. And I know our two presenters will be talking about their examples about how they've partnered in the community. So We'll listen to those in just a second. But as I close out, just want to share these two resources with you. This is the case study for transitioning to a family-centered approach on best practices and lessons learned from those 3 adult drug courts. So please feel free to download a copy of that. And then we also have this additional 3 ends handout, which covers the framework that I talked about today. And on the back of it includes even more strategies or questions to ask as you consider those 3 ends. So with that, I'm going to turn over to Tara Reno to talk about how her adult drug court in the 1st Judicial District has shifted to a family-centered approach. Tara?
Thank you, Tessa. In full disclosure, Tessa and I were co-workers in the 1st Judicial District, so I'll be mentioning her a couple times during this presentation. Our adult drug court began in June of 2009. We're an adult criminal drug court. We have felony convictions only in our program. Our capacity is about 80 active participants. And when I started in 2015, we were really focused on the participant only. We didn't speak a lot about their family, their children, how those family members impacted their recovery. We didn't offer parenting groups. And there was really no collaboration with human services. So my light bulb moment was in 2016. We started trying to form an alumni group, and that was a collaboration with Family Treatment Court. And we had a recovery court participant at the time who was very interested in helping us form this group. And she would say to Tessa and I really could have been in Family Treatment Court. I could have been in either program. She had 5 kids, and at the time that she entered recovery court, she had an open dependency and neglect case. So her commenting on that really got me thinking. Also, interacting with the alumni group, recognizing that they all had children, which was something that I didn't realize before we started this program, because again, we weren't really talking about the family or the kids in our treatment staffing or in our court staffing. And that was the only exposure as a coordinator I had to the participants. Early on in the alumni group, we realized one of the biggest barriers for our participants to attend was childcare. We were holding these groups in the evening, and they had no one to watch their kids. So pretty quickly, I realized that our drug court participants were exactly the same as the family treatment court participants. The only difference was the way they entered our program. And that was really eye-opening for me. In starting the alumni group, it morphed into a bigger program that we called Family Recovery Night, but it definitely started small, and it took a lot of work and collaboration to get to this point. But our Family Recovery Night includes a circle of parents in a recovery support group. It includes childcare for children ages 0 to 5 years old. We have a recovery group for children aged 6 to 13 years old. We serve dinner to the people that attend the groups and their children. And then, of course, it includes the alumni group. So the why behind the change for me was, again, my interaction with the alumni and current participants through the Family Recovery Night. I was interacting with them on a more personal level than I was during court or listening to their cases during staffing. And then, because it was a collaboration, the recovery court participants and the family treatment court participants were talking to each other and were comparing program requirements. What did you have to do in family treatment court? What did you have to do in recovery court? And overwhelmingly, the feedback from the recovery court participants were that we didn't address their children at all. And that really hit home for me. And talking about what Tessa mentioned earlier was I wanted to increase our program success rates and found out that just offering a parenting class would help me with reducing recidivism and cost savings. And that seemed like something pretty simple I could implement in my program. So again, this started really small. This change, it's still ongoing, and it definitely did not happen overnight. I started asking the team about parenting classes because, again, even though our program had been around since 2009, I had started with the program in 2015. So I just said, why don't we offer parenting classes? Have we ever offered parenting classes in the past? And the treatment provider said that they had offered it in the past, but they never had the numbers to sustain the group, which didn't seem like correct to me. So I just mentioned maybe we could go through the entire program and just identify the parents that had kids. And as I suspected, it was over half. It was a very substantial amount. So the treatment provider agreed to offer parenting classes again, started a group, and we were able to sustain that group ongoing. We never had a decrease in participants. And that just became part of their ongoing treatment plan. Any participant that had children was placed in that parenting group at some point during their program. About the same time, we had grant funding to implement intensive outpatient treatment, and we were going to implement the Matrix curriculum. And the Matrix curriculum includes a family group component. They're very big on sober supports. And so I was part of that implementation. And the family group component was focused on the parents of our participants, not their children, but really having to work and identify how we could get their parents involved, get their sober supports involved, get them to attend, what that would look like. And then in staffing, just slowly starting to talk about home life. When we were in treatment staffing, who do they live with? Do they have kids? Who's involved with them? And as Tessa mentioned, talking about sanctions and incentives in our court staffing. So when we're talking about a behavior change, for example, we had a client, if a client was like missing services, instead of responding and saying as a team, well, they're missing services, let's give them work crew. The conversation changed to, they're missing services this week. What's going on? And the probation officer being able to say, well, they have 4 children, they're on the bus, they're on methadone, so in the morning she has to get all 4 kids ready, they get on the bus, they drop these 2 kids off here, these 2 kids off here, she has to go dose. And so our team is able to really look at what is impacting the behaviors and how we can help either remove barriers or have a response that helps them be more successful. And then increasing contact with caseworkers if they're involved. We have a client and she has an open dependency and neglect case, and her case is in a different county than she's in recovery court. And so really collaborating with that other agency to decrease the barriers for our client to be able to see her kids, meet her treatment plan with them, and do what she needs to do for recovery court. We also, about a year ago, had a change in our treatment providers. The contract was up with our provider at the time, and we were realizing that other providers in our community offered a lot more family-focused services that we didn't have to work to implement. It was already part of their culture at their treatment agency. So we did make a shift in our treatment providers. And one of our current providers, they offer specific programming, intensive outpatient, sober living, and inpatient for mothers and pregnant women. And they already had a family group in existence that targeted those parents in sober support. So that was a big change as well for us. And then just recognizing, like Tessa mentioned, collecting the numbers and collecting the data. Over the last 3 years, 70% of our participants reported living with their family or friends when they entered our program. So we know that their addiction has been impacting those family members, and their recovery will impact them as well. And how could we get them more involved and get them more support? So as part of our family recovery night, we expanded and added another group. 2 nights a month, it is a support group for our parents of the participants. And then 2 nights a month, it's a psychoeducational group. And that teaches them about addiction. It increases their support for them as the family members going through this with our participants. And it really increases the buy-in from family members to our program and what we're trying to accomplish. And very recently, within the last month, and I want to highlight that these elements of our program, these changes we've made, sometimes just come out of nowhere, come out of something else. So for example, in the last month, we've partnered with a local library to offer story time at Family Recovery Night for the kids between dinner and before groups. And really where that came from was the parents and kids eating and the kids finishing before the parents, and then the kids running around and the parents still eating. And we had about 30 minutes before group and we didn't know what to do with the kids. So just again, reaching out to your community and partnering with different agencies can be really helpful. So now we have a story time that's exposing kids to reading, which we know is positive. It's modeling this for parents. And then the library has also agreed to have a mobile checkout and return. So most of our parents are on public transportation, so this allows them direct access to library books. And they're discussing starting a book club in the future. And then our alumni group is very, very active. And once a month they have a planning meeting, and part of that planning meeting is figuring out what they're going to do. They do sober, fun events, and they also do volunteer events. And they do an event about once a month, sometimes twice a month. And they always invite their kids. Their kids are always part of it, and so are their family members, their spouses, their parents, their cousins, their siblings. They're always involved and they're always coming to these events. So what that has done was increase the family engagement in their recovery process. And again, it's modeling that for their kids and relatives, the sober, free fun and volunteering, giving back. And they require the family members that attend these events and volunteer things have to follow the same substance-free requirements, and that includes alcohol and marijuana. These are just some pictures, some of the things that they did. They did the Rally for Recovery this year, and they do an annual kickball picnic every year as well. And as you can see, there are kids and family members all there. And they're very proud to share this with their family. We've changed our incentives to be family focused. So when we're giving things away, I try to get things that their families can engage with them in. So pumpkin patches, zoo tickets, sporting events, amusement parks, as well as sanctions. So of course we're not sanctioning their parents or their kids. But we do encourage our team when we're thinking about how to respond in court, how can we really make an impact? So these are some examples that we use: writing a letter to your child, attending that circle of parents and recovery group. There's also a local fatherhood program through the Department of Human Services in my county, and we utilize them a lot as well. And then just a couple other elements with our program that I identified as family-centered are we work with our CASA so that our participants, they do an annual giving tree every year where community members can come pick a name and kids what they want for Christmas off a tree, and then they go buy those gifts, and then we give them out to the families. And normally it was just human service, people involved with the human service department, but we've been able to participate as well for the recovery court participants. So they're able to write down what their kids want for Christmas and get those donated. We also, for our graduations, include all of their family and friends. They're all invited, and they come. All of them come. And the judge also asks them to speak, and they always do. The kids speak, the family members speak. They talk about how proud they are of their family member and their recovery, and it's a really special day for them. So again, this doesn't happen overnight. It's a process. So some of the challenges that we had were resources. You know, I think that's across the board. People think of these initiatives and how could we ever do this? But really collaboration is the key. You most likely can't do it alone, and there are a lot of agencies and people in your own courts that are willing to help. So I really collaborated. I think Family Recovery Night is a collaboration with at least 10 different agencies. Location can be really difficult. Again, look to your community. We were able to work with a church for our location that is free. It's consistent, so we always have the same place, and we're able to accommodate the growth of our program. And then funding as well. Our funding, the main funding cost we have is dinner, and how we were able to really accommodate that is by promoting it. So Tessa and I really promoted to our stakeholders how beneficial this was and the changes we were seeing, and how excited people were, and we were able to get a couple different funding sources to help us with that dinner expense. And as always, getting team buy-in for change can be difficult sometimes. So just communicating, educating your team on why these things are important. Usually I like to pilot things, or sometimes I just start them on my own, and then the team will see the benefits. They'll see the change as long as you continue to promote it and talk about it, and the participants will talk about it. Attendance was hard in the beginning when you're starting something. So some of the strategies we utilize to keep people coming, we still use a sanction to circle of parents in recovery. That's a response we use in court a lot. We promote on Facebook and in court the events the alumni group is doing. And the family treatment court here has now required their participants to attend the alumni group at least once before graduating. And in recovery court, we have sober support meetings that are required in phase 3 and 4, and we give them credit if they're attending any of these groups. So alumni group events, any part of Family Recovery Night. And we also incentivize it. We've done raffles, and we've given away gift cards and tablets, and people are really responsive to that. We definitely have room for improvement. We're not at the top of that spectrum Tessa talked about earlier. I think we're still somewhere in the middle. Some of the things that I would like to see over the next couple of years would be to have additional childcare options during some of our program requirements. For example, during court, instead of having children in the courtroom, I would like to see an option for childcare during that time. And then also during treatment, we have some very basic childcare during some treatment, but it's not enough, and I think we could expand that. And then also looking at the participants' children, offering them treatment if that's appropriate, looking at assessing them and getting them treatment services, because we know that the addiction has impacted them and the recovery will as well. Some of our future goals are one of our treatment providers, we have 2 currently, is trained in community reinforcement and family training, and the goal is to implement that in January 2018. And that's a program that really gets the sober support, the parents involved in the beginning and brings them in. And then also implementation of celebrating families. The family treatment court received some grant funding to put this into place. It won't include the recovery court participants. But we've already started talking about how they will sustain it beyond the grant after it's implemented, and talking to some other community agencies about that. And that's my vision, that through their grant and their, which will force them to figure out how to sustain it beyond grant dollars, that we'll be able to expand to include recovery court participants as well. And that's it. I'm going to pass it over to Judge Montero now.
Well, thank you, Tara. That was very impressive. Thank you for that, and welcome everyone, and it's a pleasure to be here today. I'm Judge Michael Montero, and I'm going to try to focus my comments a little more probably from the perspective of being the judge, and how I've seen things develop over the years that I've presided over an adult drug court. Just by way of a little background, which I think is really important, because when I saw that first poll, it looked like we had about 54% of those who are on this webinar that are from rural areas. Now, maybe that's changed because I see that a lot more participants have joined the call since then, but I think that's wonderful because I'm going to be speaking from really a perspective of a rural court. And let me put that into some context for you. I'm in a small town by the name of Winnemucca, and it's in Humboldt County, Nevada. Humboldt County is a county, and as you can see on the slide, and the far northwest portion of the state of Nevada, which is about 10,000 square miles, which, so if you compare that, it's probably close to the size of the state of Maryland. We have a population in our county of about 18,000 people. So we are very rural. The town that I'm in has about 8,000 people. I am the only district court judge, and I know we have judges from across the country, and titles are a little bit different, but it's a felony court. Being the only district court judge, I preside over a number of different specialty courts, as you saw in my bio. But when I started here, and I came on the bench in 2009, even though my slide says established in 1999, that's when our adult drug court was established. I was elected as a judge here in 2008, took office in 2009, and I inherited an adult drug court. At that time, that was about the only specialty court program that was being offered in our county. It was small at the time. We now average about 60 participants a year in our adult drug court. But it was at that time I came from the private sector. I was practicing attorney in Reno, and for a little more geography here, Reno is about 170 miles to the south and west of us, and then in the opposite direction, the largest city would be Salt Lake City, Utah. So we're on the I-80 corridor, long distances between neighboring towns. Reno, 170 miles. Elko, Nevada, which is to the east of us, is about 120 miles, and those are the only two towns that are I could probably go to for services outside of our own community. Of course, when I started, as a judge over the adult drug court, it was pretty typical. We were seeing those clients who had come into contact with law enforcement. Most of them, some connection to a drug-related type offense, and they were being diverted in many instances into our adult drug court. Now, by way of background also, I came from a private practice where I had very little experience with criminal law and no experience with family law. I was a trial attorney, and when I was elected in a small town where I really grew up. I was born and raised in the Winnemucca area, although my practice prior to that had been in Reno. So I was really new to diversion programs, specialty courts, and what it would take to run treatment programs or treatment courts in rural areas. And I think that's one of the things that I want to focus on today, too, is that I so often heard when I first started here that, gosh, this is rural Nevada. We're such a rural area that, you just can't do those things here. Everybody was complaining about it being a rural area. And I think, to me, that became a real challenge, and I've worked hard to overcome that stigma of being rural and having fewer services. So I think as we talk about kind of light bulb moments, for me it was about 2 years into my first term as a judge when I had a young lady who came before me for sentencing on an unlawful use of a controlled substance, pretty typical type of case. My slide says she was 30. I looked back at my file, and she was 28 years old and had a severe substance use disorder. She had, in the precinct's investigation report, I noted that she had domestic violence in her past, and I also noted that she had children. But when she moved to Winnemucca, this is an area where gold mining is really the predominantly drives our economy. And she moved here because her husband got a job in the mining industry. And so they moved here, and I noted that they were without their children because their children had been removed from their care in Southern California. And so as we started to engage this young lady in our adult drug court, we started thinking, and this is for me when it came to light, is, if we really want to achieve success, we're going to have to address this issue of this young lady not having her children. She had a 3-year-old and a 1-year-old that were in the care of the state of California, down in Southern California. We also learned as she started to progress through our program that the children then were placed with a family in her dependency case in the state of Oregon. So we were dealing with 3 different states, Nevada, California, and Oregon, long distances between them, and wanting to try to figure out ways that we could help this young lady, who we've now identified as a mother, who has children, which were clearly important part of her recovery or long-term recovery, is how could we start to help with addressing and making this more of a family-centered approach to her treatment. So we started, just doing that, collecting information, getting releases of information so that we could talk to people, and specifically in her case. And I'm pleased to say that over the 18 months that she participated in our adult drug court, we were able to facilitate a lot of discussion with other agencies, which I think was really key. Because before our involvement, I think that there was, not a lot of communication occurring between caseworkers and treatment providers and in different states. And so we really stepped in. And, of course, I wasn't the judge presiding over her dependency case, but I think with the team that I had, we started looking into how we could make her present and help her with both her dependency case and her drug treatment. We were able to really get engaged with the state of California. I think at one time we actually had one of my team members who traveled with her to California to attend hearings. Also, we were able to give her permission to travel to Oregon to visit the children. And as a result of that, shortly after her graduation from our program, after 18 months, she was reunified with her children. So that was really the case that kind of brought to my attention how we need to involve the entire family to have success. We have, over the years since then, have had some contact with her. I know she's had her struggles, but I know that she's also has she's been reunified with her children and has had success in that area. And had it not been for that, I'm sure that she would have, I'm pretty confident that she would have been cycling through our system. And that's what we're really trying to avoid is to reduce that recidivism. So as a result of this, we've started looking at other things that we could do in our court to address more of a parenting services in our adult drug court. Since that time, in full disclosure, we have started some other programs. We have been fortunate to receive funding to start a family treatment court. But every Monday when I hold my adult drug court, I'm looking out into that crowd, and I'm seeing so many parents who are struggling with addiction, who, because of the way they came into the system, they're not in the family treatment court. They're still in our adult drug court, and we see that they really need the engagement. So we've added some things. We've hired some additional staff to provide parenting and family services. We've engaged other partners in our system, which has been really critical. Even in our adult drug court, there are times when our Division of Child and Family Services will participate as a team member in our adult drug court. We've engaged with our school district as well to make sure that we have some input, because there's the families, the schools have so much input in how families are doing. We've just worked hard to build community partnerships, and I think this is, being in a rural area, one of the things that we really can do. It's easier maybe for us, one of the advantages is we can get the people together in the room from the different agencies around our community. And I think that becomes one of our real strengths in having more of a family-centered approach to treating those people who are in our adult drug court. We have also, I have a slide here on why this is important, because as I stated, when I first started, I was looking, I was probably typical to many, new to specialty courts, I was looking at the person who was before me and what was the crime or offense for which they were entering the system, and if they had drug addiction or abuse, how we could address that without really looking at the bigger picture of how to help them succeed long term. So we started identifying, as I think Tara said earlier, or Tessa before that, the Montana system, identifying those who have children and the role that played in both their treatment and the effect of their addiction on the entire family. We had very little services at the beginning for those adult participants, but now through collecting information, having this relationship with other community partners, we've built a really strong, I think, family-based adult drug court. We've added celebrating families, strengthening families, and now moving towards nurturing parenting. We have parenting classes. We work with, as I mentioned before, the school district, the local Boys and Girls Club. We're also providing a lot more in the way of kind of habilitation services to families and individuals, housing and transportation, some of the things that really specific now to families is really key for us as well. And making sure that we're connecting these parents with these services as early as we can in our program, and we're finding that has helped improve our outcomes. And we're at, right now, I believe we're about 75 to 80% of no contact with law enforcement within 1 year. And I think that the recidivism rates are really outstanding for our community because we started paying more attention to addressing the entire family. I think it's one of the things that I really have found that has been important to this is developing these relationships. One of the things we did is we were struggling with, oops, I maybe went to that a little too soon. One of the things that we were struggling with is because we're so rural, having really these family-based services, we've gone so far as to put together in our community a service provider with a little oversight from the court and a lot of support from some great team members, what we call the Family Support Center, where we brought under one roof a lot of our service providers in our community, which you have to realize because of our size is very small. But we've brought together this Family Support Center where all these mental health services, parenting classes, drug and alcohol treatment are really all housed under one roof, which we found has been really critical to our success, because then people that are in our programs aren't having to try to find the different resources in different places around our community. And also it's important because we have a lot of our families that have to travel long distances. to even come here for services. One of our outlying towns is 70 miles away, where people come from to get services here in Winnemucca. So I think that has been a really important part of kind of our success in offering services to families. Just as a small anecdote to this, just yesterday, which is when I have my specialty courts, I unfortunately had here on almost Christmas Eve a family where both the mother and father, who were in our adult drug courts, had relapsed. And I think, as we heard some people talking about before, is we've got to be aware of what it's going to do when if I have to sanction them to jail time for this, what that's going to do to the family, and especially at this time of the year. So we made the accommodations to ensure that the family isn't suffering from a parent having to serve a sanction, if that includes jail, especially when both parents have relapsed at the same time. I think that just the awareness that is brought to us in paying attention to to families in our program has been extremely successful in helping them long term. So I probably could go on and talk a lot more about our program and some of our successes, and both our successes and failures. I just wanted to share that one, and I think that if I've learned anything from this is we really, as judges, have to surround ourselves with a good team. I think the case that I used an example where I had one of my team members who was willing to go all the way to Southern California and attend a hearing with a mother who was struggling with both her addiction and trying to be reunified with her children, was a great example of how dedicated the team is, and that's critical to our success here. As a judge, my contact oftentimes with the families will be much less than the service providers and case managers, and so to have the team members that have truly that dedication to seeing families succeed and the success of your program is critical. And I've been very fortunate to put together maybe a small team in comparison to some, but a team who really believes in the goal of helping the entire family. So thank you all today for participating, and with that, I think we're going to turn it over to questions if that's next on our agenda.
Yes, thank you, Judge Montero. Thank you so much to all of our panelists today. And we are now transitioning into some Q&A. While we have these three presenters on the line, we want to utilize their availability to answer any questions you may have. So please do look on the right side of your portal. You'll see a Q&A box. There's also some blue buttons at the bottom where you can also access the Q&A and submit your questions there. We have had one come through, and I'll just offer this to all of the panelists. So one of our participants asked, are any of these courts using family peers who have lived experience involved in their services?
So this is, go ahead.
This is Judge Montero, and we do. We have a individual we contract with, our service provider, peer recovery specialist, who is both was a participant in our program, successfully completed that, and is a parent. And she was successfully completed our program. It was the adult drug court, and is now working as a peer recovery specialist for us.
And this is Tara. We don't have a parent that's been through our program that's in that role, but we do have a parent that works with our program and the family treatment court that was through Jefferson County Female Offender Program years ago, and she now works with our program very closely as a peer support.
Okay, thank you so much. We have a few more questions. I do want to note to our participants that we have our final poll active now. If you would like to provide any input in terms of additional information you'd be interested in learning about around this topic, please fill out that poll. Another question is that the National Association of Drug Court Professionals shares that focusing on family can actually reduce disparities in program completion rates in the treatment court setting. And so I just want to ask the panelists, what should these treatment courts be thinking about in terms of considering what cultural needs may exist among their participants as they shift towards addressing the entire family? And that question is for all of the panelists.
This is Tessa. I think one thing is really looking, again, in the community where your program is and where your participants are living, and looking at what services are already out there that meet the cultural needs of your community. Anything that's community-based versus kind of systems-oriented and things that the families can access even once their involvement in the system is finished will be really helpful. Sometimes family resource centers can be really tied into the community and meet the needs of community members. So anything like that would help meet those needs and potentially reduce the disparities.
Any other comments about cultural considerations?
Yeah, I'll add, this is Judge Montero, and I'll add that one of the things that we have a significant Latino population, and so we've added counselors and other recovery specialists that are Spanish speaking because we recognize the need for that. We also will occasion in court use translators when needed, and I grew up in a family where my father our first language was Spanish, although unfortunately he didn't teach me as much as I would have liked, but I find myself resorting to my really broken Spanish sometimes in court, which of course gives everybody a wonderful laugh and is fun to try, but we do have to be, I think we do always have to be cognizant of the cultural needs of our participants in our programs, and we do everything we can to address that.
And this is Tessa again. I would also add, I think, two pieces. One, going back to that data piece and counting. So if you know who you need to serve, that's going to help you figure out what services need to be in place. And second, we also talk, when we're talking about cultural considerations, looking at fathers and the unique role that they play and how, if there's different services out there for fathers specifically. Maybe, I know in the first JD in Colorado, they partner with the child support court, and so helping them remove some of those barriers and getting more engaged with their children that way can be a good way to engage fathers.
All right, great. Thank you so much. So another question, and this is directed towards Tara first, but I also welcome input from the other panelists. Tara, you went over some ideas of sanctions and incentives, and so the question is, how were those created? And what are some ways that other treatment courts could brainstorm effective sanctions and incentives to involve the family approach?
So the incentive part of it is basically me, as the coordinator, researching and Googling what family activities are out there, and then also speaking to my team members, probation, and the treatment providers on what the clients and their families like to do and what they would be interested in doing, and speaking to people that are parents in general in our community, and what do you do with your kids, where do you go, what do you think people would like to do? So it's really communication and doing a little bit of research. If you don't have, we have a nonprofit that supports us, that we have funding to buy tickets for those things, but also our community has free days at the zoo, free days at the museum. So just looking into those options. and seeing what you have available. And then as far as sanctions, I think that's, again, a team approach. We are constantly talking about different ways that we can engage participants and change their behavior in a positive way. Some of the sanctions have been around way before me with making a poster with their family members, but also on NADCP's website, I believe they have a list of sanctions and incentives that would be helpful to take a look at, and then just seeing how you can craft those if they don't already include the family members.
Thanks. Tessa or Judge Montero, any other ideas or suggestions around developing sanctions or incentives that consider the family?
It's always a tough one to answer, but I think, as we just heard from Tara, that I think you really have to try to know your recipients of the, especially if we're talking about incentives, what's going to help motivate them, and what do you have available to you in your community. And of course, there's always that issue of cost. So I like what she said in that regard, because that's similar to what we do. We try to identify what's going to motivate someone and what's available to us. With sanctions, and as a judge, I'm a little bit all over the place with this, because I think the sanctions in an adult drug court are significantly different than the kind of the sanction scheme in our family treatment court. And so, you know, I guess I'd have to be a little more specific on that. I think it ranges everything from sometimes just a simple admonishment by the court can have a profound effect on the participants. I make all of my participants in the early stages of my adult drug court journal for me. And, you know, it's a kind of a private communication between them and their opportunity to talk to me. And when I've had to admonish them in court, boy, it's amazing sometimes what they write about, how that affected them, how they feel like they let me down. And I think that can be a significant sanction in and of itself, although it may not seem like it in some people's eyes, but to the client, that can be significant.
This is Tara again. I just want to piggyback off of Judge Montero because it made me think of something that I do, and that is, if you're an adult drug court, find a family treatment court and talk to them. We're lucky enough to have one here in my, same courthouse, and so I speak with the coordinator for the family treatment court a lot about what they're doing, ideas that they have, and so, in drug courts, it's all about not reinventing the wheel and just taking people's ideas, and so just find a family drug court and talk to them.
I would also add just ask their participants, do a survey one day at the beginning of court asking what things would be, really motivating to them for incentives and also for responses or sanctions. And as far as sanctions, and, we talked about a little bit of this in the material, but, when you're looking at sanctions or what they need and making sure you're looking at the behaviors, and if you have participants who have children, making sure you're not giving them a sanction because they missed something due to being a parent. If they're taking care of a sick kid, so they miss a class, things like that, that shows the participants that you're considering their whole situation and caring about their family as a whole versus just the requirements of the program.
Wonderful, thank you. We've had a couple more questions come in through the portal. One person asked, how do you motivate graduates to participate in alumni groups?
This is Tara. So one of the things that we have done, a couple of things I mentioned that we've done is really promoting it and advertising it and showing pictures of the fun things and talking about the things that the alumni group does. And also, recently, we saw a bit of a decline in our attendees. And so what we have done is our program requires a 40-hour restorative justice project from each participant to graduate. We created a restorative justice project that is an active participant ambassador to the alumni program, because what we were finding is that the graduates had been out of our program for like 3, 5, 10 years, and the current participants didn't know who they were anymore. So when they were going to treatment groups or coming to court and speaking about the alumni group and what they were doing, the current participants were like, I have no idea who you are. So this position allowed us always to have an active person in our program engaged with the alumni group and promoting it and recruiting people. So that has been really beneficial. We actually have 2 participants at any time engaged in that role and getting credit towards their project. And then again, incentivizing it, really making it their own. We had them name it. They created their rules, their mission, their norms. And so those are some of the strategies we've used.
I would also add, so when Tara and I were creating this together, we received the advice that, alumni groups can be really slow to grow, but you just need to stick with it and have it, once a month on the same day at the same time in the same place. And we did that, and it was very slow going. I think for the first few months we had 3 people, and then it was 2 people, and then it kind of kept going up from there. But you just have to be really patient and just agree. I would definitely say do it with somebody else. I think that was probably the most helpful thing for me, was having Tara there so we could share the responsibilities and keep each other motivated to do it. But even if there's only one person coming, just keep it going. And then, really a lot of what built off of that program was talking to people about why they weren't coming to the alumni group, and those things were dinner and childcare and things like that. And so that's why we started building a lot of that in. So we would definitely encourage just stick with it, 1 month at a time until it'll start growing, and it'll catch on eventually. I would also say look at what's in your programs that you could use as feeder groups into the alumni group. So maybe there's some kind of peer support group through your treatment provider. In family treatment court, sometimes they create reunification support groups for parents a little bit later in the program who are working on reunification. That can be a really great group to feed into an alumni group because it's those people already giving support. Maybe a celebrating families group, anything like that exists, that people already have those peer connections that you could feed into alumni.
Great, thank you. We've got a couple more questions. The second one, I'm going to break it into 2 separate questions. First, he asks, are there opportunities for family members to get into a treatment facility if they express a desire to do so through your program?
So I can start on that one. So there's some new legislation that passed in February of this year called the Family First Prevention Services Act. And I highly encourage everyone to look into it in their state. States have the option about whether they want to opt in or not this first year. But what it does is it makes some of the child welfare funding flexible and allows residential treatment facilities to receive payment for children being placed in residential treatment along with the parent. So there is way more involved to the bill than that, and I won't go into that by any means. That's a 3-hour webinar in its own, but it's something to ask about with funding because there's the potential, and it depends on how states do it and how your counties do it, but there is the potential to have funding for the child and the parent in a residential facility that treats both. So I'm thinking that might not be the complete question about other family members. As far as that goes, if there's a spouse or a boyfriend or girlfriend or something like that who also needs treatment, that's where, looking at your bigger system, looking at parallel initiatives about substance use treatment. There's a lot of funding right now around the opioids, so the state opioid response dollars, or SOR. So talk with your single state agency, sometimes that's the Office of Behavioral Health or whoever that is in your state, and talk to them about where those dollars are going, because a lot of those, especially if you have people affected by opioid use disorder, a lot of those dollars are may be available depending on how your state's using them to support residential treatment. And then also some states are starting to get creative or more flexible about Medicaid dollars for residential treatment as well.
Yes, and this is Tara. We are lucky enough to have 2 agencies in the Denver metro area that we can utilize. One is for pregnant women, and then they can remain in that program. I think it's up to about 6 months after the child's born. And then we also have another program that just reopened. It had closed for a while. That is for families as well.
This is Judge Montero, and just quick input is we have the ability for family members to receive outpatient services, and many times I will require that adult family members living in the same household be required to drug test. But if you're talking about more inpatient type treatment facilities, that's a little more complicated.
All right, thank you. The other part of the question was, once the drug court is starting to transition into looking more at that family orientation, what are some ways to get family members involved and willing to participate when starting out?
I'm just going to say, in our adult drug court, if we have a family or a parent with children, they're required as part of one of their phases to go through Celebrating Families. And we've had wonderful success with them, even though maybe only one parent is in the adult drug court, but great success in getting the entire family to participate in Celebrating Families in a meaningful way, because they quickly realize the benefits, and it's a fun way for them, to get together and have a meal and engage in some activities that I think they find that it's rewarding and beneficial to all of them. So it hasn't been really a problem getting them to participate, and I make them do it. At least the person who's in the adult drug court, and the family kind of comes along.
And this is Tara. So for the kids portion of it, for our family recovery night, the kids love it, and the participants love bringing their kids. And then for the parents, what I do is we mostly in our adult drug court see parents at sentencing. And then after that, unless we get them engaged, we don't see them much. So as the coordinator, when their family member is being sentenced into our court, I go approach the family and speak with them and give them information about the support programs we have for them and how they can become involved. Our probation officers are really interactive as well with family members and encourage participants to sign releases of information so that they can be part of the process, as well as treatment providers giving us and feeding us information on how we can do that. So it's a very much team approach, but just really getting them engaged at the beginning, I think, is the most helpful.
All right, and the last question we're going to cover, we just got a couple more minutes, and then we'll move into the downloading the handouts. It looks like we have someone who is involved with an adult drug court and they're meeting tomorrow, actually, to discuss forming a family dependency treatment court pilot program. And this person asked, for the very first steps during their first meeting tomorrow, is there any advice for them to consider?
Absolutely. So we actually have tons of resources on starting a new family treatment court. We co-released a planning guide on family treatment court planning guide that talks about the five big steps to consider and has lots of examples and resources. We have a webinar on this, so we have lots of assistance for treatment courts who want to get started and to be really planful and thoughtful and intentional in how they're doing that. So I'd be happy to share those.
Any other pieces of advice?
Yeah, I would just reiterate that. I think there are some great programs out there, and hearing what Tara's saying, I think take advantage of that. Take advantage of what some other courts are doing, and get those materials, and don't try to reinvent this wheel all on your own. Reach out. People will help you.
Okay, thank you so much. So that brings us to the end of the Q&A portion. However, if you are interested in the two handouts, that Tessa reviewed during her portion, we're going to have that download popping up for you right now, and you'll be able to download the 3N handout as well as a report that was generated last year around transitioning to a family orientation in your drug court. So those the opportunity to download those handouts should be popping up on your screen. And we also had a poll open for more information, and so everyone is aware we will have another webinar focused on increasing the focus on families in the treatment court setting, and so we are planning a follow-up webinar to this in the new calendar year, and so we will be using these poll results to inform that webinar. It looks like at this point, most people voice interest in family-centered interventions. We have some interest in learning more about parent education curriculum and family involvement for people with co-occurring disorders. So we really appreciate the input that all of you have provided. And we also have some open solicitations right now through the Game Center. If you are interested in having a sequential intercept mapping workshop in your jurisdiction, which helps you map out what diversion opportunities exist to move people out of the justice system into treatment and services, we have an open solicitation and welcome your application by December 21st. We also are providing technical assistance to communities interested in expanding their SOAR programs, and this is specific to criminal justice programs. So this would increase your local capacity to help people qualify for benefits, and particularly the focus would be people who are justice involved and eligible for benefits. Again, that solicitation is the applications are due December 21st, and you can find more information at that link below. And so that brings us to the end of this webinar. We really thank you for your participation, and this is the final webinar of this calendar year, but we have lots more coming your way, so please stay tuned for our next webinar in January, which will be focused on assisted outpatient treatment and some guidance on providing that to people who are involved in the criminal justice system. So we look forward to having you all join us then. And on the screen is contact information. If you have any other questions or would like to be placed in touch with the panelists today, please reach out to us at the Game Center for Behavioral Health and Justice Transformation. And again, just want to extend a warm thank you to all of our panelists who provided such rich information today. You know, they are truly promoting a shift in the paradigm in how we think about treatment courts and effectively serve the families that are involved. So thank you so much to all of our presenters today for joining us. And with that, we will end this presentation. Thank you so much.
Thank you.